you all will be able to come back and watch it, or if you're not able to watch the full length, you can come back and catch it, and it will be available for you to watch at a later date. So this is a great turnout. It's so good to see some faces that I haven't seen in a while, and some names or from a previous walk of life. So Shirley, I'm definitely chatting to you. We were driving around this past weekend, and I was like, I miss going to see my districts. So I do miss getting out to see everybody. But so for those of you that joined us in October for the VNPC webinar series, there was not as many people that were able to join us. I think it was because of the miscommunication, and we also had just held the summit. So I'm sure several people were like, another VNPC thing. So I did want to, so this may look a little familiar. There is updated information, so you're not going to be wasting your time if you join us again and you joined us in October. We definitely have made some progress from October to January, but there are some similarities, and we will touch base on a couple of those same topics, maybe a little bit more in depth. So let me go ahead and share my screen. And okay, if somebody could either chat in, because I know most people aren't on camera, which is fine. If you can just chat in, can you guys see this okay? It should say VNPC Year in Review for 2020. Okay, perfect. So for those of you that don't know me, my name is Shannon Purcell. I am the Director of Operations for the VNPC, and went in advance. So the VNPC did officially move from VDH to VCU in May of 2020 last year. And for those of you, Shirley's one of them that knows me from my previous life, I was at VDH as the maternal infant health coordinator, and but I have now taken the role on as the Director of Operations at VCU, and it is my full-time job with for the VNPC. And this is the first time we've actually hired a full-time individual for the VNPC. We have restructured some of the teams, and I'll show you an org chart here shortly with that. And we did hold our first virtual summit, but our 4th annual summit in October of last year. All steering committee members, which we currently have 6 members on the steering committee team, attended IHI training in the fall. More to follow about that, because we're going to start having opportunities to possibly extend that opportunity to our executive committee and co-chairs for upcoming projects. And I say that now because at the end, there is a form. We now officially have a volunteer form that you can actually fill out, so we can start developing a directory of individuals that want to volunteer with the VNPC moving forward and take advantage of some of these training opportunities. Currently, the VNPC website is under construction, but I will have an update later in the presentation for that. I do want to say that we did do our final data collection for our OB hemorrhage in December of 2020. So we just wrapped up with that. And we did hold our first year of our VNPC webinar series, which is what you guys are attending right now. And we held 11 different topics and 11 different calls last year. So well received, well attended, and we plan to continue that with into 2021. And then due to COVID, we were able to be responsive to that, and we did hold, it started off as bi-monthly calls, and then we moved them and morphed them into monthly calls. But those as well have been well intended. And just as a little plug, the next one is this Thursday. For anybody that's interested, drop me a chat message in the chat, and I'll make sure you get added to that invite for this Thursday. It will be at 12:30 on Thursday. All right, without further ado, let's jump into the, sorry, writing myself a note so I don't forget. Jump into the restructuring. So our steering committee still looks the same. We still have an OB co-chair, and we have a pediatric neonatal co-chair. we still have representation from the Virginia Department of Health. We have representation from the Virginia Hospital and Healthcare Association, and we have a representative from the neonatal nurse practitioners as well on our steering committee. So the executive committee, again, this is not the representation of all the organizations on the committee, but we do have a representation of essentially every professional organization that touches moms and babies in Virginia, a representative on the VNPC Executive Committee. We also have the governor's office. We have several nonprofits, and we are currently still looking for some family members that would be willing to step up to the plate and hold these positions. So if you know of somebody or somebody that's in advocacy specific to maternal and infant health topics, I would love to have some information, or if you can pass that along. So our current quality improvement projects that we are underway or that will be launching very shortly. We just wrapped up the OB hemorrhage. I think I'm too afraid to just knock this off because this is our first one. But yes, this one will be moving to sustainability or has moved to sustainability. We have our maternal opioid use disorder. We have our neonatal abstinence syndrome work group. Our NICU antibiotic stewardship will be launching very shortly. And our maternal mental health is actually going to morph into the 4th trimester. I'll explain a little bit more of this further in the presentation, but we aim is taking 3 of their bundles and putting it into one. And essentially, we're going to call it the 4th trimester with metrics for that. So that one will be launching very shortly. And then we have our committees that they're here, our advisory committees that we just have all the time, and that's our data management, our Maternal Quality Care Alliance, which I'm working with Stephanie Spencer. She is the co-chair for that to stand that up. And then under that, or working very closely with that, will be our Birth Equity Network. Again, more information to follow, but we're working on developing the vision and the goals and the work plan for both of these groups. We'll also be launching a stakeholder advisory panel and then an advocacy advisory committee. So lots of opportunities to be getting involved with the VNPC, and many of these are either reforming or reshaping. So now is definitely the time to be filling out this volunteer form, which I will highlight at the very end of this. All right, so I did want to put in here that the VNPC website is under construction. You can get to it right now, but you will notice there's several things in there that have changed or have already passed. So the details need to be updated, but the majority of the information is correct. But what I want to definitely highlight is the fact that we will be relaunching the website on March 1st, and it will relaunch with a new face. So more to follow with that, and it may launch sooner if you want to keep checking that out. All right, so for where are we at with data, I did provide a brief synopsis of this if you were on our OB call. I'm not going to go as deep as I did last week, but I do want to say that we had 37 hospitals submit data in July of 2020 for the OB hemorrhage, which was about halfway through the project. Then we had 23 hospitals submitted data in December for the OB hemorrhage, which was the culmination and wrapping up the project. So I am in the process of actually compiling a report for that. And once that report of our lessons learned, what did the data look like? What did the data show? What's the plan for sustainability? And how are we going to move this forward and maintain the efforts that we've already done, along with a list of all the hospitals that participated. I will be hopefully getting that done here in the next probably 3 or 4 weeks. And once that is done, that will rest on the VNPC website. So it will be available for everybody to see. We also have created a data collection tool with about 55 questions. We worked in partnership with Illinois to create the survey through REDCap, specifically looking at the mom and baby dyad specific to substance use disorder and NASH, along with structure measures for each of the hospitals. And we have launched it in a very small pilot. However, there has been a little bit of kickback because of the number of questions that are asked, and then also the ability for us to link moms records with babies. And so there is some hesitation. While it is all de-identified once it gets put into the system, there is some questions of, to ensure the privacy for all patients. And that's what we definitely want to ensure. And it is happening, but more to follow. I'm going to probably be doing some independent reaching out to each hospital system and walking them through the steps and ensuring that the PHI is actually suppressed and there's no way to really figure that out. So, and we're also looking at this from a global, statewide effort. So how can we better learn what's happening? And then how can we make recommendations to improve these areas that we know definitely need addressed? So more to follow with that. Also another opportunity to volunteer if you'd like to volunteer and maybe help with some of these presentations or help with the data aspect of that. And then moving on, we will be collecting antibiotic stewardship baseline data here probably within the next month. We're a little behind. I know I keep saying this, we're a little behind the 8 ball, but some other things have come up. And I think with all of us virtual, moving everything to virtual has definitely added some additional layers that we weren't initially expecting. And then we will be launching the AIM 4th trimester patient safety bundle in early spring with metrics. I say early spring because we're waiting for AIM to finalize the patient safety bundle, which will be the compression of the maternal mental health bundle, the delivery to postpartum bundle, and then the postpartum to transition to women's well care. All of that will be compressed into the 4th trimester, and we'll really, for 4th trimester, looking at pretty much that time frame from delivery and discharge to almost, I know it's its 4th trimester. I think once we can transition women to a well women's exam, that would kind of be when we were done with that patient safety bundle. However, that looks different for every patient. It's not a one size fits all. So that process may be for one patient 12 weeks. It may be 6 months for another patient. So recognizing that kind of end time of when that woman transitions back to well women care is something that the group will either later define or provide guidance for. So very excited about this bundle. I think we will definitely, the Commonwealth will benefit from what we learn and things that we implement with it. All right. So I don't want to spend too much time on this, but these are the hospitals, and I know everybody's looking for their hospital right now or their hospital that serves their areas. So this is the hospitals that did complete the AIM patient hemorrhage that submitted data. And I want to, these were the hospitals that submitted data. There may be others that completed it, but didn't provide data for us, so we have no way of tracking that. So as a caveat, if your hospital did participate and just didn't submit data, please reach out to me and I'm happy to open up the survey and we can get that hospital data entered in so that your hospital will show up on the dashboard as being completed. Okay, and I do want to go back real quick and I do want to put this out there, kind of transparency. One of the things that when we stood up the VNPC, transparency was one of the big things that we touched base on and we discussed, but we do have an annual report that is due to the General Assembly every year. December 1st is when it's due. I have to turn it in a couple months before to make sure it goes through all the reviews and edits, but it is actually due and submitted to General Assembly by December 1st of every year. If you Google VNPC General Assembly report, you will find it. The one for this year has already been submitted and it has been uploaded into General Assembly. It's now a public document. I say this to say that if you go to the back of it, it does have a list of all the hospitals that were participating that signed the agreement. So this coming year, it will be all the hospitals that have submitted data for the OOB AIM hemorrhage bundle. So if your hospital submitted it, your name will be in there. We're not going to call out who didn't submit data, and we're not going to call out who didn't participate. we will highlight those hospitals that did submit and did participate that we are aware of. So a little caveat that if I don't have the data, I can't put your name on this list. So if you want your name on the list, please submit your data. And then also HRSA by way of AIM. HRSA provided a grant to AIM. AIM then provided subrecipients down to some states. Virginia is a subrecipient of that grant. So our data also gets submitted to HRSA. And I did just have to submit a survey 2 weeks ago of all the hospitals that submitted data to date and the number of births that occurred by hospitals who were participating in AIM OB hemorrhage, and that went up to the national, so that went up to HRSA. So I do want to complete transparency. The data is being asked for, and the data is being, the hospitals are being mentioned. So webinars and calls. I know there was a little bit of confusion when I mentioned this in October, and I wanted to spend a few more seconds on this, just so that there was clarity. So there is a difference between our quality improvement calls and then our webinar calls. So you are currently on a webinar call, the VNPC Webinar Series, which is the third Tuesday of every month from 12, and we're going to probably extend that to 12:30, 1 o'clock, because I know some of our topics were very well attended, robust information, but we didn't have enough time for Q&A, or we had to rush through the topic or the talk quickly, and maybe we didn't get to expand on all the information that we wanted to. So they won't be longer than an hour. Hopefully most of them will be between 30 and 45 minutes, but the time frame will be from 12 to 1. So these are topics that if you have an idea for a topic that you think everybody would love to hear about, or you just want to hear about it and you know somebody that's willing to present, let me know. That's these topics. These are just generic, general information. How can we support the maternal and infant health population? It can be anywhere from Title 10, Title 5, what is it? We have a couple of talks coming up of Title 5, what is it and how does it impact my community? We have another call coming up that's PRAMS 101, which is Pregnancy Risk Assessment Monitoring Survey. What is it? Why do I care? Does it collect data that I'm interested in? We're going to break that down. Last year we had a talk on our LGBTQ population and how do we interact? How do we make sure that we're providing respectful care to this population when it comes to reproductive health? So it runs the gamut. There's no specific topic that we always talk about. It's different every single month. So that's another thing you want to tune in every month because the topics vary. They will all be recorded. On Wednesday, right now, currently the second Wednesdays of the month, which I believe we're going to be moving this to quarterly pretty soon, is our OB hemorrhage call. And what we're planning to do with that, moving now into sustainability, is to do quarterly calls for that on the second Wednesday of the month, and to provide hospitals who are doing well with specific measures to highlight how they're doing it, where were their stumbling blocks, how did they overcome it, and how can they improve, or how can they mentor or work with other hospitals that just aren't there yet or that have questions and want to get up to that point. So those are what those calls are for, all specifically related to OB hemorrhage. There'll be no other topic that is discussed during that time. It will be related to OB hemorrhage, the process and structure measures. And then on the third Thursday of the month, we still are having the maternal and infant COVID calls. Now, this is open to anybody, and there's not usually an agenda for this. How these calls kind of transpire is everybody that's on, we kind of have a general touch base of the hospitals that are on, give a brief update of where their hospital is at and what is the current protocol for their pregnant population. Do they have to be tested for sections? What's the PPE that's required? How many visitors are allowed in the room? Are doulas considered support personnel, or are they considered one of the visitors? So we talk about all these kind of very high-level topics that seem to be coming up with every single hospital, but looking at how each of these hospitals are different or where they're at with the discussion on these topics. Then from there, we then open it up to the audience, and anybody that has specific scenarios that have come up over the last month that they want to discuss, or the topic right now that we talked on the last call, and I'm sure we're going to take it a little bit further this coming Thursday, is what is the recommendation for your patients who are breastfeeding and or pregnant related to the COVID vaccine? There is no consensus right now. CDC, the latest guidance that I've seen says talk to your providers. Well, providers are like, so what are we recommending? So these are some of the discussions that we're having right now. And we kind of just talk amongst ourselves. Usually these calls are about 20 to 25 individuals. So great group, great information, and a wonderful resource if you're interested in that. And then we will be starting early, probably next month or March, we'll be starting monthly antibiotic stewardship calls as well as the fourth trimester. Fourth trimester probably won't start until April or May for the monthly calls for those topics. So lots of calls. You don't need to be on all of them. They'll all be recorded. But I want to give you an opportunity to really see what's going on, ask your questions, and really be the resource for anybody that has questions. So, and by the way, while I'm talking, if anybody has any questions, I do have the chat up so I can see if anybody has specific questions. I'm happy to answer any questions that come up while we are having the discussion. Janine, I just saw your picture again. I love it. Her picture, picture on her screen is, what'd you say, 6 or 7 years ago? I love it though. All right, so steps for 2021. We have a lot planned for this year. I'm very excited for this year. So we are going to launch the NICU Antibiotic Quality Improvement Project. We're also going to launch the fourth trimester quality improvement project. We're going to continue to add data to the AIM dashboard. If you are a hospital and you are a maternal infant provider or lead, you need to be able to access this data. If you want to see it, email me. All I've got to do is submit your email and then you will be able to see it. There is a wealth of information on this dashboard, and it is hospital specific and it is specific to Virginia, but you can also share and you can compare your hospital to other hospitals that are de-identified across the state, and then other hospitals at the national level. You can see how well your hospital is doing compared to others. You can also see the state maternal mortality morbidity rates as it pertains to OB hemorrhage right now, and then we will be adding in additional data from the state level as we open more projects. So definitely highly recommend the AIM dashboard to be a part of it, and you guys will have, you can have read access for your hospital. So that's definitely a huge benefit at the hospital level. We are working to create a maternal disparities dashboard, and that will be available and viewable on the VNPC website once it's launched. We are also doing our first strategic planning for the VNPC this year. We're finalizing the goals and vision for the Maternal Quality Care Alliance, and then we will be launching that. We'll also be launching the Birth Equity Network this year, and then we're also going to be holding our first stakeholder advisory panel. For those of you that are not familiar with this, the stakeholder advisory panel will be ideally representation from each payer across the state, both private and public, and then also to have not a decision maker at the table for that payer, as well as an expert in maternal and infant health, because they're two different things, but they're both needed as a whole to really help move these recommendations forward as we bring more to the table. And then our social media launch. I don't know if Donald's on the call, but this is exciting news. We have been wanting to do this for a while. We've been saying we were going to do this for a while, and I will be completely honest, it took me getting an intern in here that knows her way in and out of social media, because that is not my area of expertise, but I'm quickly learning. So we now have a VNPC YouTube channel. I would say you could find this there and you could reference this, but it will be there and you have to be able to get there. So if you type in Virginia Neonatal Perinatal Collaborative, it will go to our YouTube channel. So all recorded webinars, recorded calls, recorded summits, anything we record with the VNPC from here on out will be uploaded as soon as the call is over with, will be uploaded within a couple hours to YouTube. So you can then share that link and disseminate it out to anybody that you want to watch it, or if your colleague missed it, you can just send them the link on how to catch it. So that is live currently now. And there's the VNPC, the virtual summit is on there. The call from last week is on there, and this call will be on here by later today. We also now officially have a Virginia Neonatal Perinatal Collaborative Facebook page. So my ask to you all is to go and like the page and share the page. We're still trying to get, there's basic information up there right now, but this is how we will be communicating when registration opens for maternal mortality or perinatal and infant mortality summit, which is March 1st. Mark your calendars. Everybody should have gotten a save the date. Registration will be opening this week, but we will place the link for the registration on all of our social media pages. So like these pages, this is where you will get the most up-to-date information. We have a Twitter, Virginia Neonatal Perinatal Collaborative, and the LinkedIn page is coming soon. Again, Virginia Neonatal Perinatal Collaborative, and our Instagram page is coming soon with the Virginia Neonatal Perinatal Collaborative. There's a theme there. And I learned this. I was told that we need to have at least 2 handles that we put every single time we post, so that individuals can just search on these domains to find our information that we're putting out. So if you put something out, I attended the VNPC webinar call today on updates of 2020. It was great. Hashtag VNPC. We will all be able to see that, and it will feed to our pages. So our 2 handles that I will make sure are on every single post are hashtag VNPC and hashtag Virginia NPC. Okay, questions. Before I open for questions, I do want to say I do have the volunteer form that I will add to all the social media pages. So you can just click on the link. It's a Google Doc form. You can just enter the information in, it'll go into the base. I will also send it out via email to everybody that was on this call, or on that invite. I will send the volunteer form out so you can put your information in. If you don't want to volunteer and you want to do nothing more than stay on these calls, no worries. Don't worry about filling it out. I just have had a lot of individuals with a lot of interest that want to volunteer, but I just have it in email. And I think having it all in one place will be so much easier for everybody. Also, one more thing that I didn't mention any other time is that we are always, always, always open for topic ideas. I have about 4 or 5 topics for this year for these VNPC webinar series. We want them to be beneficial to everybody. So if you have an idea, even better if you have an idea and someone that can be a speaker for it, let me know. Send me an email, or if you have it right now, you can drop it in the chat, and I will record it and work on getting it lined up and scheduled. But we are always open to ideas, and I can't stress it enough. We want these to be beneficial for you all to attend. So without further ado, I don't have anything else. Nurse.11H, if you can just send me an email to request the COVID call, only because I don't know your handle. That'd be great. Just shoot me a quick email and I'll send it right after this call. So I'm going to stop, and if anybody has any questions, you can either chat it in or just unmute yourself, and I'm happy to answer any questions you may have. Or if you have any ideas that you want to throw out there, that'd be great too for upcoming webinars. All right, well, I do not want to take up everybody's time. It is 12:33. I will let everybody go. As always, if you have any questions, any comments, please send me an email. I am very responsive to email. And I look forward to seeing everybody I look forward to seeing a surge of on our Facebook, YouTube, and other social media accounts. So thank you very much, everybody. Have a great Tuesday and stay safe and healthy out there. Bye.